There was a time in Iraq when people enjoyed one of the highest standards of living. There were 1,800 healthcare centers, but 2 decades later, that number is less than half, and almost a fourth of them require major rehabilitation. The war has ended for the U.S., and as the troops leave, they leave behind a grim picture of disaster and destroyed lives. Our correspondent Daniel Khan takes a closer look at the health sector of post-war Iraq.
The struggle for a better healthcare began in Iraq with the beginning of the U.S. invasion. Almost a decade and over 1 million deaths later, the public hospitals of the war-ravaged country lie in shambles. According to the Health Ministry, over 3 million people have been maimed in the U.S. bombings. The Ministry of Health towers over the Baghdad city, home to a population of over 30 million. Inside, a sleekly dressed-up spokesperson of the government, Dr. Ziad, reassures us that all has been well since the U.S. invasion.
After 2003, we built 600 primary healthcare centers, and by the mid of next year, we will make another 26 hospitals. And I can assure you that after the U.S. occupation, the healthcare system has become better in Iraq.
But when we visited the Ibn Nafis hospital, the ground reality was completely in contrast with the Health Ministry. This is one of the 70 larger healthcare centers in Baghdad, with a capacity of 100 beds. It is supposed to have a 24-hour emergency staff, as over 500 patients visit this hospital every single day. But Dr. Basma Jafar says the hospital lacks adequate facilities.
We lack a lot of things. We lack human resources. To start with, we are very little. We have not that many doctors, as much as we need, at least. They can't cover the need. And also we have a lack of drugs. We need lots of drugs that are not available. We have amazing doctors, but unfortunately they are all leaving abroad, and they are making good careers there.
Used medical instruments and waste lie unattended in corners of a busy emergency room. The elderly patients we spoke to complained about their health problems.
I have pain in my hand, and doctors say it can lead to a heart attack.
I have a heart problem. Whenever I walk, I feel pain in my heart. My pain is continuing, and I often visit this hospital.
The word big is not enough to express the disaster these people are facing. As their health deteriorates, the condition of the remaining hospitals also declines steadily. Despite signs of a public health crisis, medical experts say it is hard to get foreign donors to pay attention, which is the only hope they have. In the early 90s, Iraq was known as the jewel of public healthcare system in the Middle East. But after the imposition of sanctions and the U.S. invasion, many experts say that now that the U.S. troops are withdrawing, they are leaving behind tracks of destruction which could take decades to recover. Daniel Khan, CCTV, Baghdad, Iraq.